When Jewish ethicists evaluate CRISPR gene editing technology, they do not begin with fear of science, they begin with responsibility. In Jewish bioethics, the core question is not whether humans may intervene in biology, but whether they are doing so in a way that preserves life, dignity, and moral restraint. One of the most important principles guiding Jewish reflection on CRISPR is Pikuach Nefesh, the obligation to save human life. This principle holds extraordinary moral weight. In Jewish law, the preservation of life overrides almost every other religious commandment. Because of this, gene editing that aims to cure disease, prevent serious suffering, or save life is often viewed not merely as permissible, but as morally praiseworthy. If CRISPR can prevent a child from inheriting a lethal genetic disorder, many Jewish ethicists would argue that failing to use such a tool could itself be ethically problematic. Closely connected to this is the Jewish understanding of human partnership with God. Judaism does not see humanity as passive observers of creation. Instead, humans are viewed as co-creators with God, entrusted with the task of improving the world, a concept known as Tikkun Olam, repairing the world. From this perspective, medical innovation is not a violation of divine order, but often an expression of it. Vaccines, surgery, organ transplants, and now gene editing can be understood as extensions of humanity's responsibility to reduce suffering and promote life. However, this openness to therapeutic intervention does not translate into unlimited approval. Jewish bioethics draws careful moral boundaries. One of the most significant concerns involves germline editing, genetic changes that are passed on to future generations. Here, caution intensifies. Jewish ethicists worry about making irreversible decisions on behalf of people who cannot consent, future children and descendants whose lives may be altered in unforeseen ways. There is also strong ethical resistance to non-therapeutic genetic enhancement. Editing genes to cure disease is morally different from editing genes to enhance intelligence, physical traits, or appearance. Enhancement risks turning children into products of design rather than recipients of care, and it raises serious concerns about human dignity, social inequality, and modern forms of eugenics. Finally, Jewish ethics places heavy emphasis on unintended long-term consequences. Even when intentions are good, humility is required. The Talmud repeatedly warns against acting with certainty where outcomes are unknown. CRISPR's long-term effects, biological, social, and moral, are still unfolding, and Jewish ethical reasoning insists on restraint, oversight, and ongoing moral evaluation. So the bottom line in Jewish bioethics is this: CRISPR used for healing is often supported, especially when it clearly serves to save life or prevent profound suffering. But genetic enhancement, irreversible hereditary changes, and poorly understood interventions are approached with deep skepticism. The goal is not to stop science, but to ensure that science remains in service of life, dignity, and moral responsibility. In Jewish thought, the question is never simply, can we do this? It is always, should we, and at what moral cost?